24,000 people will be diagnosed with colorectal cancer. This accounts for at least 13% of new cancer cases, but it's almost one of the most preventable if diagnosed early. So joining me now to talk about this campaign, top to bottom, very catchy name, Dr. Zane Cohen, colorectal surgeon from Mount Sinai, and Amy, pronounce your last name for me? Elmahel, the head of Colon Cancer Canada. Thank you so much for coming in.
Welcome.
So top to bottom, this is the third year that this campaign has happened. Tell me a little bit about it and how the involvement is bringing about doctors getting in there, because it's not just here at home in Toronto.
So it's really exciting for us, Colon Cancer Canada. We started top to bottom 3 years ago as a campaign to reinvigorate a gala evening because it was costing too much money. So we tried to find a campaign that would involve doctors across the country that would help raise money for local colon cancer initiatives. It started with Zane Cohen and Dr. Andy Smith as well in Toronto as our first team of it, and we grew last year to 3 cities, 21 doctors. This year we have 40 doctors in 6 cities: Toronto, Vancouver, Calgary, Winnipeg, and Vancouver. I might have missed some.
And it's become kind of a competition between the cities, so it's been fun. It's a good way to raise funds, and the funds are being used for different purposes in the different cities, but all for cancer-related projects, colon cancer-related projects. Right.
Let's talk about colon cancer, because I think the stat was, what, 90% preventable if treated early. Is that right, that stat?
If treated early, if you are colonoscoped or if a polyp is found, it's a pre-malignant condition. If you get rid of them, you can reduce the rate of cancer, colon cancer, and in fact, colon cancer has decreased slightly over the last 5 to 6 years worldwide. Is
it because people are going in and getting themselves checked out?
I think so. I think that it's not so much people going in, it's the awareness and the push really to get people to go in and have testing, whether it's fecal occult blood testing or whether it's imaging or I think, but mainly colonoscopy. I
think it was, what was it, last year, I think Kevin Frankish went in, had a colonoscopy on air, and he talked a little bit about the prep and all of this, and it's not as bad as it's made out to be, right?
The perception is much worse than the reality.
Yeah.
So the preparation is what people complain about most, but you do have some sedation, and really you remember very little once you've had the colonoscopy.
And I think that's what we try to do at Colon Cancer Canada, is to really try to raise awareness of the necessity of screening and to really try and sort of destigmatize it, because people are so worked up about the test and all of that, and it really can save lives. So everything we do is really trying to raise the profile and tell people, really, you don't have to die from this disease. We have to raise the profile and we have to raise awareness.
Sure, of course you want to be preventative, take as many measures as you can, but let's just say there are symptoms. You're tracking it a little bit late. What are the things to look out for?
Well, bleeding, change in bowel habit, those are the main things.
I want to get back to the campaign a little bit, and how exactly does it work? When does it kick off, and how can people help out?
So it kicks off today. We're really, really excited about it.
Today's the launch.
Today is
for
the launch.
For a month, right?
For a month. For 5 weeks, we've got all these doctors. It's really a virtual campaign. You can go to our website, ccctoptobottom.ca, and you can search for your doctor across the country, and you can donate that way. You can also, when you make a donation, a minimum donation of $250, you get a gift card to one of our participating restaurants, so you get a great night out on us. And it's really a great way to have fun, and it really is a tiny bit competitive for all these doctors. We're very fortunate to have 40 of the top colorectal specialists really participating for us, so it's really exciting for us as we've grown across the country.
And I was thinking, actually, I understand that the viewership is around 1 million people. If everybody gave $1, we would have it. We would have our goal. So get out there and give more than $1, but if you can only afford $1, give $1 and we will have our goal.
There's the challenge to all of our BT viewers. Thank you very much. Really quickly, I know you can't really speak to it, but Mayor Ford, doing well?
Inappropriate. I cannot speak to it.
Okay, we can't speak to it today, I know, but we do wish him well, of course, in his treatment. Let's go.